Earlier. Oh,
Hi, everybody. Welcome to this episode of Weekly Dose with Dr. Uday. I have Dr. Postpost here with us today. Did I say that correctly, actually?
yes,
Yes,
that's perfect.
Dr. So, we are going to be talking all about depression. So Dr. Popo is going to be giving us all that information. So before we get started, I'm going to start with introductions. So my name is Dr. Uday. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine. I also do aesthetics. And so my goal is to have my patients not only feeling good, but looking good. I'm going to be giving you a little bit more information about our special guest today. So Dr. Sarah Postfos is a board certified psychiatrist. She's based in California. She is devoted to helping others feel their best again when dealing with burnout, depression, anxiety, and other common psychiatric challenges by incorporating exercise, nutrition, sleep, stress management, and efficient time management. She's also published extensively on burnout and depression. So, Doc, thank you so much for being here with us today.
Of course. Thank you so much, Dr. Uday, for having me. So glad to be here.
Pleasure. So we're going to be going right into this. This is something I'm pretty sure you deal with all the time. So first things first, what would you say depression is from your perspective?
Yes, great question. So, depression is one of those terms that perhaps get thrown a lot, right? We often hear someone said they're feeling depressed, and it could be interchangeable in terms of just quote unquote regular sadness, feeling sad on a day to day sort of thing. So, in terms of psychiatric definition, so to speak, for depressive disorder, um, the one of the most important points, perhaps, is if this depressive symptoms has interfered in any way with someone's daily function. And that could look like different things for different people. For example, if you're a student, it may look like it starts impacting your grades. If you're working, it may start interfering with work. It may, impair relationships with your loved ones, family, friends, what have you, and so forth. Um, Having said that, what are the common symptoms of depression? So depression could look like could look very different to everyone. However, some of the common symptoms may include feeling sad, perhaps having crying spells, feeling tearful, feeling down most of the days. Um, it could look like losing interest in the things that used to bring joy in the past. So perhaps your hobbies, things that you enjoy doing in the past. And these feelings could impact your daily abilities in sleeping, let's say, in concentrating, in focusing, in decision making. It could also affect your appetite, your movement. Perhaps someone could notice that you're moving slower than usual. It could introduce negative thoughts that may look like, feeling helpless, hopeless, excessively guilty about something, to all the way to having suicidal thoughts.
Gotcha. Okay. And how common is it? Yeah.
Yes, unfortunately, it's very common. So statistics differ, but I would say, at least one study mentioned that in the US, it could affect up to 6 to 7 percent of the population each year. Having said that, it's rated as the number one cause of disability. And also with regards to the presentation, one important thing to note, I believe, is that those who are depressed is could also feel anxious. So these two could coexist together up to 50% with regards to coexisting presentation.
So, Doc, how do you formally diagnose this?
Yes, great question. And I just wanted to emphasize that uh, this wouldn't be medical advice. It's just purely for educational purposes. In terms of diagnosis, first and foremost, during our psychiatric interview, typically during our first visit in a psychiatric evaluation, we would ask about what's going on in your lives with regard to the current symptoms that you're having, how is it affecting different areas in your life, and other typical questions just to get to know you better. In terms of depression, again, the main key point is perhaps that it could, when it starts impacting your daily function, as we talked about earlier, it should raise a flag in terms of whether it meets quote unquote the criteria for a depressive disorder or not. Um, Diagnostic wise, depression could also come in different flavor. For example, if meeting certain timeline, we could categorize it as major depressive disorder, or if it's slightly longer, we could categorize it as dysthymia. It could have different factors. If it only happening, for example, during the winter, in relation to someone's menstrual cycle, after pregnancy, it could affect the technicalities of the diagnosis as well.
And then formally, how is it treated?
Yes, so for depression as well as other common mental health conditions, psychiatric conditions, we do have several options. Those options could include psychotherapy, which means talk therapy. And within talk therapy, there's also several different types that could be utilized. We have the options of medications if indicated. And for depression, we also have several different options with regards to depressive medications too. It's also important to rule out any potential underlying medical causes, right? Because some medical conditions could mimic quote unquote some depressive symptoms. For example, some medical conditions could present as having low energy, feeling fatigue most of the time, um, and things along those lines. And lastly, it's always important to note how certain lifestyle factors, for example, drinking or smoking, could also affect someone's mood and address that um, as well.
Absolutely. Thank you so much. This is all very good information. So I'm going to switch gears a little bit and just ask, this is a question I ask everyone that comes on. Why do you do what you do?
Yes, such a loaded question, huh? So me personally, in terms of psychiatry, I also focused in perinatal and sports psychiatry, and the reason for that, I have to confess, is I do have some personal stakes in these areas. Meaning, I had my first child, and I'm currently a mom of two under two, and I had my babies during medical training. And previously, in my other life, I was a student athlete as well. So I thought to myself, what better way to pay it forward than to focus on these groups? Because I think having that firsthand experience, firsthand personal experience, in addition to the professional training and experience, could really help someone in this position, in this group, two different groups that we're talking about.
That's awesome. Okay, and then the next question, and very last question, is completely different, but the answers are always so helpful to our audience. And that is, what would you tell your 20-year-old self if you could meet your 20-year-old self, in light of all the experiences that you've had so far? What would be the advice you would give your 20-year-old self?
Oh my gosh, Dr. Ude, that's also another loaded question, huh? So I think my number one advice to my younger self would be, hmm, try to focus perhaps on the day to day, meaning for a lot of us,
Hmm.
it could become a habit, or at least a mindset, a way of thinking, to try to always chase some milestone, right? For example, taking my case, just as an example, after undergrad, the next goal would be med school, the next goal would be a residency, the next goal would be further training, and the next goal would be XYZ. It never ends. And I used to think that after giving so much energy, time, effort, blood, sweat, and tears, to achieving these goals, once I arrive there in that particular milestone, I'll feel better.
Yeah.
However, looking back, I am realizing more and more, and it's a process. Sometimes it's easier said than done. That the day to day is more important. So the quote unquote journey is more important. Perhaps how we spend our day with regards to um, having set some time chunk aside to just to enjoy our hobby, or being present with our kids, connecting with old friends, things like that. It's really, really important in the long run versus just focusing our mind to achieve that future goal, that future mindset.
Absolutely. That's such great advice. Is that whole the journey is definitely more important than a destination, because sometimes you're just focused on the next best thing, the next best thing. Or when you get there, you'll be happy. Happiness starts right now. It's with every day. So that is great advice. That's why I ask it, because it's always and most people say a lot of similar things, but it's just the way it's said, and it always kind of hits a nerve. So there's always somebody out there that could help. And just to repeat that disclaimer, that Dr. Puswas was alluding to, this content is for informational purposes only. So if you have any personal concerns or personal medical issues, please direct it to your personal physician and have it taken care of as such. Dr. Postwas, thank you so much for being here with us today. If people wanted to connect with you, how would they be able to do that?
Yes, definitely. So if you're in California, I do offer virtual appointments, serving all of those in California for psychiatry. You can contact me in my website, lifestyletelepsychiatry.com. If you're not in California, I still do offer additional free resources to help out. Could also be found on my website, or you can get in touch on Instagram as well with the same handle, Lifestyle Telepsychiatry.
Awesome. Thank you so much. And for those of you listening, if you're looking for a quality primary care physician, and you're local to us in Martinsburg, Apple Valley Family Medicine is accepting new patients. Our phone number is 304-350-1087, and you can find us online at www.applevalleyfamilymed.com. You guys have a wonderful week, and thank you so much for joining us. Dr. Postwas, thank you for being here with us today. All
Thank you so
right.
much, Dr. Day. Have a good one, everyone.